What's going on, everyone? It's Organically David here. Welcome back to my channel. Thank you for joining me on my journey as I strive to live organically and authentically in every way. It is my goal and my duty to help you do the same. As you know, this is your place to be for all things organic, all things holistic. And I want to give this disclaimer before I get too far into this video. I am driving, so I apologize for looking off into the distance, as well as any type of road noise. I think I'm okay as far as the sound and noise goes, but I do want to give that disclaimer. I'm trying to make sure I'm being safe out here. But I wanted to get this part 3 out because it's extremely important that we talk about in my wife's journey through cancer, how we addressed it holistically as well as conventionally, and combine the two in order to get to where we are now, and it's cancer-free and in the maintenance stage, and how we were able to minimize the side effects with adriamycin cytoxin and completely eliminate any type of side effects from the Taxol. Made it through all of that and without any significant side effects. And then now I want to take us up to surgery and proton radiation therapy. Just to give you some context, again, on part 1 and part 2, we discussed the diagnosis in part 1. That's under live, so if you want to check that video out, it's under my live section. And then part 2 is under the regular channel videos, where you will see part 2, where we talk about chemotherapy specifically and how we were able to apply some holistic techniques through that journey to minimize and eliminate side effects. And I'm excited about that video because, and it's a little long, but I'm excited about it because it really is going to help you out if you're going through a journey, or if you know someone who's going through the cancer journey. Please share it with them. I did break it up into chapters, so you can go through to the description, and you will see that I labeled each segment based off of whatever the topic was. So please check that out. But today we're talking about, on part 3, we're talking about surgery and radiation. So just again, my wife had stage 2 breast cancer. It was ductal carcinoma. She had one lymph node involved. They they gave her a solid prognosis from the beginning, but it's just been increasing as time has gone on because she's tolerated everything so well. Her cancer type is hormone positive, so it's progesterone or estrogen positive, mainly estrogen, and she is HER2 negative, or was. And now after she completed chemotherapy, because she's hormone positive, she had a hormone positive cancer. It normally doesn't respond to chemotherapy as well as someone who's not hormone positive. The good part about hormone positive breast cancer is that it's very, very common. It's about 80% of the breast cancers are hormone positive. So they know a lot about how to treat it conventionally, as well as holistically, naturopathically. And so she completed the 4 rounds of adriamycin cytoxin. She completed the 12 rounds of Taxol, and she's good to go. Everything is going well. And she waits maybe about 2 weeks. About two weeks. And it was a little fast because there was no concern from the oncologist. Because her white blood count had always remained high and was never an issue, never dropped, was never an issue. So she's not concerned about scheduling the surgery immediately. So she scheduled the surgery. We had it, I would say about 2-3 weeks from her final round of chemotherapy. She had a lumpectomy, a reduction in lift, and she had removal of 6 lymph nodes. And the tumors were already so shrunken down. I mean, they were tiny in comparison, just little. The one was completely eliminated. They just took the tracer out, and then the other one, the main one, that went from like 5 centimeters to 0.5 centimeters. So it was much, 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 much smaller, incredibly small, and it was like 0.5 centimeters one direction and 1 centimeter the other direction, whatever it was. It was incredibly small, and there were no signs. They tested it, sent it out for the labs. There was no signs of cancer. They took out the six lymph nodes. They take out more lymph nodes because they want to make sure that they check more than just the one. So they sent them out, did the biopsy, no cancer. The one that was affected by cancer had less cancer signs or whatever it was called, a microscopic cell or whatever, something like that. Anyway, it was responding well to the cancer, and it was reduced down to nothing. And all the other lymph nodes were cancer-free, normal, no issue. So she had a complete response to chemotherapy. She recovered. Took her about a month, to I would say to fully recover. It took about a month. She got the drains. She had to take the drains out. I know she was really happy about getting those drains removed because those are very uncomfortable, but they're important. She did develop, after they took the drains out, she did develop a lipoma, but it resolved fairly quickly. I would say a few days to a week. It resolves itself. Basically, lipoma is just fluid that collects underneath the skin in your body, just reabsorbs it. And that was on the side of the lymph node side. Because you think about it, the lymphatic system that's fluid, it needs to basically reroute, regrow, all of that kind of stuff. So we made it through that. And I would definitely tell you, with the surgery, you want to find someone who's in the middle ground, no one who's extreme, because you don't want a person to take out a whole bunch of lymph nodes just because. Take out the one that's affected, or 1 or 2 or 3 or however many you have affected. Take those ones out, and then take out the few extra. But you don't want somebody who's just going to take out 45 lymph nodes and then cause you lymphedema. So made it through the surgery, and she tolerated everything pretty well. It was good to go. And then she started with proton therapy. And that's what we're going to spend more time on talking about on the proton therapy front, because that was the proton therapy was probably, or any type of radiation, is probably the most challenging for your mental health. I definitely would say that, because it becomes a lot. It's never just like 1 or 2 rounds of radiation. It's always a lot. And so my wife had 33 rounds of radiation. Some of those were boosters. I think it was like 7 boosters, which are just short bursts. And radiation is very quick. I mean, you go in, and it takes maybe 10 minutes. The majority of that time is spent of them putting you in the correct position. That is really what is the most time is spent on, because once the machine gets going, it's very quick. So it's just because it's a lot. So proton radiation therapy for breast cancer has some side effects, and some of the side effects I personally didn't think that you would have, other than the physical side effects. I didn't think there were going to be the fatigue and the other stuff that happened. That surprised me to hear that uh, that you would have fatigue with radiation, that you would have uh, uh, other other types of well. So let me talk about what radiation proton therapy is. So proton therapy is ability to it's radiation still. It still is radiation. So uh, so you may know about regular radiation when it comes uh, to cancers. Radiation just is exactly what it is. Radiation therapy. It's a machine that shoots radiation into cancer. And I know that's a very simplistic way of saying it, but proton therapy is unique because it has the ability to precisely target cells while minimizing damage to surrounding healthy tissues. Uh, but like any other medical procedure, it does come with its side effects. And there are going to be some tips I'm going to share with you afterwards. But proton therapy specifically is a type of radiation treatment used for all cancers, but in this case, we're using for breast cancer. It's very precise. It's a very precise and targeted form of radiation therapy that delivers high energy protons to the tumor while minimizing the damage to surrounding healthy tissues. Unlike traditional radiation therapy, which uses X-rays or photons, proton therapy utilizes protons, which are charged particles. Protons have a unique physical property called the Bragg peak, which allows them to deposit most of their energy at a specific depth within the tumor, which reduces the radiation exposure to healthy tissues beyond the point of the tumor. So it's more precise. The process of proton therapy for breast cancer, just to give you a little of the nerdy stuff of the steps of it, and this may help you. There's a lot of planning that goes into it with your radiation oncologist or your medical people, whoever is helping you. They create a customized treatment plan uh, that involves a lot of imaging scans like CTs and MRIs to locate the tumor or determine the appropriate area, to determine the appropriate dosage and the angles for the proton delivery. Then there's a simulation. You go in, you'll be positioned on the treatment table, and the equipment or the immobilization devices are used to ensure precise alignment for each treatment session. This helps maintain the consistency and the accuracy throughout the entire treatment process. And then you have the proton beam delivery. During the actual treatment itself, you lie on the treatment table while the machine comes. I can't remember the name of it. It's like the cyclone or something. I don't know, something. It accelerates and the protons to high speeds. Then these protons are then directed toward the site using some magnets, and they're delivered with millimeter level accuracy. So the treatment itself is painless, and like I said, it only lasts, it's minutes. It's quick. But multiple sessions of proton therapy are required. Uh, and just you're never going to just get like one or two. You're going to get multiple. And they're administered daily over several weeks. And the exact number of sessions will depend on your specific case and your treatment plan. Then after you get your treatments, then there's monitoring and follow-up. So throughout the treatment, your medical team closely monitors your progress and any other side effects. And I would say that they know really well how your skin is going to react based off of how it looks. So they can kind of predict it pretty well on how it's going to look long term. Proton therapy offers some advantages over the regular radiation, which is the precision, I would say, just the ability to target the tumor without a lot of damage to the healthy tissues. Obviously, it may not be suitable for all types of cancer and all of that stuff, but you go through obviously that consultation. It's important to note that proton therapy, radiation therapy, is very expensive, and it's probably going to cause your insurance company to look at it sideways, especially if you have a breast cancer that's not on like your side of your heart or something, because generally speaking, when they decide to use proton therapy, it's to minimize the damage to like your heart or your lungs and all of that kind of stuff. So um, it may take your medical team uh, a little work to get that approved through your insurance company. But radiation is itself is effective, and proton therapy and radiation, regular radiation, traditional radiation, is very similar in the outcomes. It's just proton therapy just has that little more of an edge there because the precision, that millimeter accuracy is amazing, and it minimizes the damage to healthy tissues. Is something that we wanted to avoid, and we wanted to throw everything at this cancer journey. So some of the side effects: swelling, skin changes, skin burns. You think about radiation as you go in, you get changed to your gown, you go into the room, and you get onto the table. They position you how they want you to be positioned to locate the area. They do a lot of drawing, and either they draw or they put the stickers on you. Stickers don't really stay on that well, so they'll keep repositioning you and put more stickers. So basically, so they know exactly where the areas to put it on to get you with the beams. Um, and it's again, it's very quick. It's very quick. It's not like you're going in there for a long period of time. It is something where someone could drop you off and wait in the parking lot or something, or wait in the waiting room, and it's so quick. Only time with proton therapy though is that there can be delays. Most locations they're only going to have one beam because it costs millions and millions of dollars, like hundreds of millions of dollars for the beam itself. So they're probably only going to have one. They have multiple treatment rooms, but they're probably only going to have one beam, and they have to move it to each room for treatment. So that may be a lot of delays. Every location that has proton therapy is going to be very new because it's just a very new technology, new-ish technology. But a lot of places are just now getting it uh, because the cost is very. I mean, the cost is significant. I'm talking about it. It's very significant. So if you don't have insurance, or if you have insurance that's not the best, it is pricey. Radiation, anything medical care it's pricey anyway. But let your insurance company handle that. Your doctors handle that. You just be concerned about your care. So we're talking about the side effects, the skin. So if you're thinking about it, to me, the best way to think about it is that why it can be taxing to your mental health is because you keep doing it. It's 33 rounds for us. We had to go through 33 rounds. It could be less for you. It could be more for you. Just depends on your unique situation. But it's going to be multiple rounds, and I think that's what you do have to keep in mind. You think, okay, I'm just going in there for 10 minutes every day, but it becomes a lot. And And it's just like you going to outside, you going to the beach, and you get a sunburn the first day you're out there. But think about it, you have to now go out there 32 more times in the sun, and your sunburn is just getting worse and worse and worse. And so there's darkening in the skin, obviously, because it's like you're in the sunlight. And then there's skin burns and peeling. My wife didn't have any of that until we got to probably, I want to say round 20 or so. Uh, Before then, it was just a little tender red, but no big issue. Uh, it just started to become a little uncomfortable. But then after around 20 or so, right around there, 1920 is where she started to feel uncomfortable, and knowing that, okay, I got to go in here 13 more times. Okay, all right, get it together. Let's go. 2 weeks left, and pushing through that is because that's when the skin started to have its major changes. The skin is breaking, it's peeling, it's burned, it's raw in certain areas, and uh, and that was difficult. So and just now you're gonna do it on purpose. That's the hard part. Getting your mind to go there and just to say, I'm gonna do this on purpose, to get these burns again, to burn me up again. That was the tough part. But I would tell you there are a few tips and things you can do to minimize how bad it is. And that's what I want to try to give you a little bit of hope here. Not to say that it's all rough, all bad, but when you're going through it, it's just one. I would just say communicate with your medical team if you need something. They do have certain padding, because you want to reduce the friction. That would be one of the best things to do to help with your skin. It's just you want to reduce the friction. My wife said going shirtless helped. Uh, you don't want, the areas that you normally see the breaking of the skin is the bra line or anywhere there's going to be any type of friction. You want to be prepared for the side effects from the beginning. You want to just be prepared in your mind. The skin irritation is probably the biggest one. Then there's some fatigue there. My wife didn't experience any fatigue, but she did have more of the physical effects of the swelling, some swelling in certain areas. The swelling came from majority of where the incision lines were, and but mainly the swelling came from the lymph node side, and then the irritation came from right around where the incisions were. But it definitely, the burning was the biggest side effect. So I would definitely say again, you want to make sure you're staying hydrated throughout this process. Communicate with your medical team, let them know how you're feeling. They can offer up some padding and things of that nature to help. There's this one pad thing that looks kind of like it's almost gel-like plastic material, uh, that can go be applied to your skin, and basically it's a buffer between your skin and the um, in your clothing, and it protects you from, like, when you're moving your arms and stuff like that. It helps reduce some of that friction. And then you want to make sure you stay hydrated. If you're staying hydrated, that's going to help you recover and help your skin. Just, we keep talking about hydration. I keep telling you about hydration. Altogether, it's critical, just for life anyway, but especially throughout this process. Want to stay hydrated. Fatigue is always best approached by continuing to move. You want to rest when you need to rest, but if you stay moving, if you keep moving, I can tell you, it will address your fatigue. And sometimes if it seems wrong, counterintuitive to if you're fatigued to keep moving, but it is almost like it'll give you a second wind. And then your skin care. You want to make sure that you're protecting your skin, that your skin stays clean, and that you stay away from any type of abrasive, strong or harsh soaps, any type of uh, exfoliating anything. You don't want to exfoliate anything. Your skin is already going through stress and trauma. So you want to stay away from any type of abrasive, any type of exfoliating for that particular area, because it's only going to make it worse, more irritated. So you want to use what we did that helped her skin recover really well was aloe vera. We used organic aloe vera. There is if you look on Amazon for oncology creams, which worked out really well for us. I mixed it with aloe vera together, and she would just straight shellac it onto her entire body, and every single time, right after leaving, she would just put it on and just keep applying it throughout the day, and it really helped her skin recover. I would definitely say it helped her recover, and I think it helped to uh, do it uh, right after when she did it. I mean, when she would leave radiation, go into the room to get dressed, she would put it on, and I think that really helped maybe delay some of the major side effects. I think it could have been much worse for her if she didn't do any of that, uh, any type of skincare. I think it would have probably set in earlier because it's very strong when it comes to just proton therapy. It's stronger than regular radiation. So that's something that to consider, something to think about uh, when you're talking about radiation therapy, proton therapy. Stay hydrated, take care of your skin, and make sure you communicate with your medical team. They will do checks along the way to make sure that they know how your skin is doing, how you are doing all together. And then the last piece will be the mental health piece. The mental health piece is probably, again, the hardest part to go through, is because you're just doing it over and over again. But you're almost at the end. Radiation is the end piece when it comes to active treatment. Uh, and something that I don't know if you're going to be prepared for, and you may think about it, sounds crazy, but to no longer be in active treatment, that there is a part of that it may be weird to say that you can miss active treatment because you feel like you're doing something about it. And even though they say you're cancer free and it's you were in regression, now you're cancer free and there's no signs or activity of cancer and all of that stuff, but to no longer be in active treatment, it's weird to say that you kind of miss it because you feel like you were doing something to keep it away, and now you're not. And that's when I could talk about the holistic and the environmental things and making lifestyle changes. We want to eliminate alcohol, drinking alcohol. Uh, you want to decrease your sugar consumption, your exposure to chemicals and things in your environment that are going to expose you to cancer causing chemicals and substances, and your food choices. Those are the things that you can do that are active, can still considered active treatment. Uh, but radiation therapy was proton radiation was a difficult time. I think was the most challenging time for my wife, but we made it through it, and you'll get through it too. So just stay positive, stay focused on just your overall healing, your mental health, because that's going to be critical to get you through this entire process. Again, please check out Honestly Candace. She has a lot to say on this, more than I can tell you about, because she's the person that had to go through it. She had to feel it. She knows what her mental health was. So she is a great resource of information on how to be resilient throughout this process. So check out Honestly Candace on Instagram or YouTube. She has great information for you. So if there's anything else that you all want to talk about, please comment down below. Anything, any tips, anything. If you've gone through radiation therapy and you found that